Hi, everybody, and welcome. Today, I am very privileged to be speaking with Shivaun and Conn. Now, Shivaun is an accredited practicing dietitian and also a registered health coach. She's a published author, a highly sought after presenter at industry conferences, and she runs a health coaching education and training program for health and fitness professionals. Shivaun is also the director of Discovery Health Coaching and Accredited Health Coaching Australia. Welcome, Shivaun.
Thanks, Jerome. Thanks for having me.
Great to have you on the call today, and look forward to what we're all going to learn from you. So, I'm sure a lot of people are wondering, first off, what exactly is a health coach compared to a dietitian, which you both?
Yeah, exactly. So firstly, dietitian, obviously we help people with evidence-based information with regards to nutrition and maybe prevention of disease, management or treatment. A health coach is about helping people to change their health behaviours. So we help with motivation, so getting people to tap into their motivation to change or overcome barriers. And essentially we help them to understand themselves a lot better so that they can maintain that change in the long term and develop those healthier habits that people ideally want that lead to that more content, happier life.
Fantastic. So it goes a lot further than dealing just with nutrition and diet. Obviously, there's and from my own experience working with you over the past year, which has been absolutely life-changing for me. There's a lot more to it than just nutritional advice.
Yeah, exactly. It's really around the psychology of change and around mindset. So health coaching is based in the sciences of health behavior change, the science of coaching psychology, positive psychology, motivational interviewing's in there. But it really, in a nutshell, it's really about helping people to understand themselves better and their mindset, and in order to create change, as opposed to just receive information around nutrition and diet and what to do. Sometimes people can receive that information, but then they still have trouble changing or maintaining the change. So I've found marrying the two has worked really well in my career. Yeah.
Fantastic, thank you. So, as we all know, we're currently dealing with the global COVID pandemic and currently in lockdown again in New South Wales. But lurking in the background is another silent pandemic that we've been dealing with for years and years, and that is the obesity pandemic. People obviously present to physio with low back pain, knee pain, hip pain, often of a degenerative nature, and in many cases that can be related to the fact that they may be carrying too much weight and putting too much load through their joints. But what you see and what you feel is only the tip of the iceberg. Tell us a little bit about some other health implications of being overweight or obese.
I think what I do when I work with people is we pair it back to the behaviours. So weight is an outcome. And I think this is problematic sometimes when people just focus on weight because of the fact they can get to their goal weight, but then what? So we look at, all right, well, how have people got to that stage where they're overweight and it is causing issues, as you said, whether it's joint pain, etc. Obviously there's chronic diseases, heart disease, diabetes, etc. There's a lot of implications, but when we pair it back, it's usually because people's dietary patterns are not right. So they're overfeeding themselves, but usually underfeeding from a nutrition point of view. So improving the types of food that we eat, the amounts that we eat, when we eat, the timing, etc. The other behaviours too, so things like sleep and stress, and obviously, as you mentioned before, like physical activity. Lots of those lifestyle-related behaviours are actually key in terms of diseases. And so those diseases we mentioned that are associated with being overweight. So I think we really need to look at, okay, what do we want in our lives? Like, what do we ideally want? And most of us want to be disease-free or, minimize the chance we're going to develop a disease. We want to be healthy, fit, do whatever we want to do with our lives. And And ultimately, it's those behaviors that we need to change in order to get to that, vision of what we want to be. Weight just tends to be like the canary in the coal mine, or something that, is one outcome. But I think sometimes it's a danger of just focusing on that.
Yeah, that's interesting you say that weight is the outcome rather than the necessarily the underlying cause, because as we know, weight loss is a multi-billion-dollar industry worldwide. So, I mean, you've got these home-delivered meal plans and TV shopping network gadgets and supplements and shakes, and I mean, you name it, it's all out there, and and people make millions and billions in the industry. Why is it so hard for people to lose weight? I mean, it's something that's always troubled me as somebody who's struggled with my own weight over the years. Why is it the hardest thing to do? I've never met anybody who's overweight, myself included, who doesn't want to lose weight. Why is it so hard?
Wow, yeah, big question. There's a lot of reasons why it is hard. We have to look at societal reasons. The nature of how, like, our physical environment, how that's set up. We live in a really fast-paced life, but a lot of it's sedentary. We live in an environment where we all feel like we're under the pump with, time and responsibilities. So often when we feel like that, we want a quick option. And obviously we've got a society set up with lots of unhealthy quick options everywhere we go. Yeah. So I think that the physical environment is one aspect. The social environment, we also live in we're social beings, and, we like to meet up with people at restaurants or go out, and again, when we watch other people doing things, we feel like doing it too. So it's like that physical and social combined. And then there's other things too, like internal, it's values, beliefs. Sometimes belief system around weight loss is too hard, I will never do it, can be actually one of the things that holds people back in itself. Yeah. Or unhelpful thoughts, like, I've had a really hard day, I deserve this. A lot of people cope with food, or they cope with alcohol, as something to go to when they feel bad, down, stressed, bored. And whether that's because as a child we were given sweet treats when we felt upset, or they were a reward, or it's just something that we've started to do over our time and over our life. But kind of, so unlearning some of those behaviors and those patterning is why it's hard too. And that takes, that's what I work with people on. Also, I think also because sometimes people want the quick fix. So we know that actually, when you look at the science, what we call diet cycling, going on and off, on and off, on and off, actually makes it harder for people to lose weight in the long term. Right. So when they regain a lot, lose a lot, regain a lot, lose a lot, we actually sort of see their set point weight going up and up and up. And sometimes that plays havoc with metabolism and, mindset. Again, there's that, I keep doing it and I keep failing mindset, which can be really sabotaging as well. And the reality is that also that things you might see on the internet or that worked for somebody might not necessarily work for you as well. So it really needs to be an individualized approach. And I think that's also why people struggle too, because they might just go on a certain plan or a certain program, and they hear that one diet worked for somebody, so therefore it'll work for me, as opposed to really understanding, okay, well, what's my health at the moment? What experience have I had in the past? What's worked for me? What hasn't worked for me? What's the other elements of, what else is going on in my lifestyle? Like, actually, and obviously, again, that's what I do with people. I tailor it and go, okay, what's the person in front of me? What's going to work for them? What's worked in the past? And individualize it so they're more likely to get a result and sustain that result. Yeah, that was a big answer, and there's probably more I can say.
That's fantastic. I think you answered one or two of my following questions as well. So there's no single approach that will work for everyone, obviously, because people are all different, and their underlying reasons for them having gained weight may be vastly different whether they're medical reasons or lifestyle reasons or social reasons or psychological reasons as well. So what is your approach, and what can somebody expect when they work with you? I know that for me, I've loved working with you because of your very, very different way of consulting. So talk us through how does Shivaun Conn manage her patients?
I think one thing about me, and you would experience this too, is I'm very curious about my clients, and I'm definitely not judgmental, because I'm naturally not like that, but also what happens is that if you are judgmental as a health professional, it actually blocks your curiosity. And we actually, as a health professional, we need curiosity in order to understand someone actually, and understand their motivation and their lifestyle and what works for them. So you'd know that about me. I'm infinitely curious about you and what you need and what's going to work for you, and how is Jerome or my other clients going to be the best version of themselves. What's their vision for that? And then, how are we going to get you there? And I obviously ask questions about, what's worked in the past for you? What are you noticing that's working right now? What would you like to try? And obviously I can use the evidence base as well. So obviously my clients can say, well, what's some evidence around certain diets for me, or, evidence for other areas of lifestyle. So, I very much tailor my approach to everybody. And I ultimately, my goal for everyone is that they head towards this best version of themselves, this optimum version of themselves. I don't want anyone to feel like they're going on a diet, or that they feel like they can't maintain these changes for the long term. Like I constantly ask, and you'd be familiar with this, do you feel happy with that approach? And do you feel you could maintain that approach? And does that feel right for you? Because I hate when people think, oh gosh, I'm going on this diet for 10 weeks and this is horrible and I can't do this and I'm going to miss out on that. And, no one wants to live like that. As soon as you start to feel deprived or that you're missing out, then that's when you get into that diet cycle where you can't last like that for a long period of time, because you're going to rebound and you're going to want to have all the treats and not feel deprived. So it has to feel good in the now and something that you could continue with. And obviously, my approach too is about finding the positives too. And I feel like a lot of us look for the negatives. Humans have like a negativity bias. So they will often say, oh, I didn't do this and I haven't done that. And what happens is when you get into that negative headspace, people are more likely to get stuck. No one wants to feel down. So they'll stick their head in the sand and think, oh goodness, like being healthy just is all too hard. It's overwhelming. I feel terrible when I make mistakes and I'm not perfect. So you're less likely to change. But if you think about, okay, well, what am I doing right? What is working well? What am I good at? And you start reflecting on that. You start feeling like, what? I have made progress and I can do this. And these things are working. And I can just keep building on those things and getting better and better. And we know from the science, like the positive psychology science, that when we have more of those positive emotions, more positive thoughts compared to negative thoughts, then we are motivated to move forward, as opposed to the opposite, where we're more likely to be stuck. They say it's like the negative emotions are like a rudder on the boat, but the rest, like the sail, are the positive emotions that keep us going forward.
No, it's fantastic. That's brilliant. And yeah, that's very true. And what I love most is just the way you conduct your consults, not sitting in a consult room across the desk and with all sorts of things. I love the fact that we meet at the dog park, we go for a nice 5K walk and get some good exercise in there while we have our chat, and then wrap it all up at the end back at the car. It's wonderful. That's one of the things I love most about it. So So tell us about your programs and how they encourage people to persevere and not give up, in terms of how they're structured over time. Because there's no, as you mentioned earlier, there's no sort of quick way to lose weight, and it's all about staying with the program. How are your programs structured?
Yeah, so that's why my programs are 3, 6, and 12 months. And then I have clients that just refresh them. So I've had some clients I've worked with for about 3 years, 4 years, around that. Generally, you need at least that minimum of 3 or 6 months with behaviour change. The science supports that, and I've been doing this for such a long period of time that I know that clients require that support, that accountability. And the reason is that it takes a bit of time to understand yourself, and it takes a bit of time to trial different methods, different strategies. And while you're doing that, you're not doing it on your own. You're doing it with me there to provide feedback, to provide support, to say, okay, which approach worked? Did that feel good? Did that didn't feel good? All right, let's try something a little bit different. So yeah, they're structured in that way for that reason, that it isn't a 1 session, 2 session approach, unless someone just specifically wants some feedback on, their current diet, and that's all they need. Most of the time when we're talking behavior change, we're talking coaching, that does require time, and that's normal, because human behaviors, they take a long time to develop. Most of my clients are, 40s, 50s, 60s. They've been, developing habits and behaviors for decades. So it's sort of unrealistic to think you can unwind a lot of those behaviors in like a few weeks or a month. But the reality is that when you put in the hard work, and that you do, or not even the hard work, because some of it's hard work, but some of it is just really around that acceptance that it's not going to be tomorrow. It's going to take quite a few months to change, and that's completely fine and normal. But when you do take that approach, it's more likely to last in the long term than those quick sort of, I'll just do a quick program here. Those are the people I see rebounding and going on and off diets. But my coaching clients, they understand themselves a lot better. They understand their drives, understand why they do what they do. And that means they can apply it to other areas in their life as well. And then they have the tools that, even when they're not working with me, that they can tap into later down the track, which is what ideally I'd love for my clients. And the other structure, which you just mentioned, is that I believe I'm a mobile practitioner, and I, as you said, I meet people and go for walking consults. Obviously I do Zoom, phone, even before it was trendy, before COVID. I was doing that anyway, going to people's workplaces or their houses or cafes, food courts, supermarkets to do reviews. I kind of thought that to be more effective, really I've got to get into people's worlds, and to actually, as opposed to, as you said, in sitting there, just sitting down, like in terms of what I do, you'd just be sitting in a seat opposite me. And I feel like, well, obviously I've done that before in the past, but I feel like when I was doing it in the past, there was so much more I could be doing for my clients. So I just naturally started going, why don't we just take this on a walk? Why don't we go through by the coast, where you're getting a really positive experience of having a look at the water, the trees, you're feeling good after a walk. We've also talked about, diet and health. So it's like tick, tick. And, or, meeting, as I said, at supermarkets or cafes where people require a little bit of support. They'll say, Shivaun, can you just take me through the supermarket so I understand what to put in my trolley? Yep, sure. That's so much better than sitting down with someone and talking them through the supermarket. Let's actually practically do it. So yeah, I'm very much about, I guess, the practical side, and also just getting the best outcomes for my clients. I'm just passionate about that, which is why I designed my programs the way I did.
And it's a lot of fun as well, getting out there, building up a bit of a sweat, getting the fresh air, getting the oxygen through the brain. And I found that I've taken in far more than I would have sitting opposite you in a seat. And also, just another point on the length of the programs, the big benefit that I've found with that is, well, 2 benefits. Is number one, it's long enough to be able to make a commitment to yourself. To make positive change, and the second thing about the length of time is, well, I've lost my train of thought there, but there was it's almost set and forget, isn't it? Where you don't have to worry about consult to consult. It allows you to set realistic, time-based, smart goals as well. That's what I've forgotten. That's what I wanted to say. It allows you to set really good, smart goals, which have a time-based sort of deadline. and that's what you're working towards. And it feels so good when you hit those goals, and it really gives you good motivation to go after them.
Yeah, exactly. I love what you said about set and forget. That's exactly the way I would like to put it as well. Might steal that.
Yes.
But yeah, because with my clients, we'll be like, all right, we're working together for 6 months. What do you want to achieve? What's short-term goals? What do we want to achieve by 6 months? And we're not at the end of each consult going, oh, where are you at? What do you feel like, instead of that, we're just going, you know what, we're together for this period of time. I've got your back over that period of time. You can email me, you can reach out, that you're working with me towards those goals. So yeah, you said it beautifully.
Thank you. So with us all being in lockdown at the moment, and even over the last year and a half, not necessarily in lockdown, but a lot of people still working from home and having changed their routines can go out the window. How important are routines for maintaining healthy living habits? And routines, obviously, things like sleep and exercise, and working at home, there's the fridge and the pantry on tap. How important are routines, and how can we do better to maintain them?
I would say that behaviors need to be consistent, but there can be flexibility in the behaviors. And I think we can't be too hard on ourselves in the way that, we have to do exactly the same way of eating and exactly the same exercise, no matter what's going on in the world or our lives. Because the reality is that when we have that mentality, people are more likely to go, oh, I can't do my gym session now. Oh, I'm not going to do anything at all. Or, so we need to go, all right, I'm a person that wants to eat healthy and it's important to me, or a person that wants to be active, or that's part of my goals. I can't go to the gym now because people, aren't going to the gym with COVID or whatever. Or, I'm no longer in my office environment, I'm at home, but I still want to eat healthy. I still want to be active. So what can I do? And I always say something's better than nothing as well. So if you are going through a really busy period, just be kind to yourself. But the organisation of the planning, I would say, is key. And that doesn't change. There always has to be some organisation and planning, because the reality is if we don't organise and plan, then that's when we end up with no food in the fridge, or just some, shelf food that we can't really put together a proper meal. So there has to be a little bit of forward thinking around, okay, what kind of week am I coming into? Is a crazy hectic week and I need to have really fast, healthy solutions on hand. And that can be really simple things too. That can be ordering things like meal delivery services that are healthy, with those frozen, ready to go meals, or, some of the meal delivery services where they come with a recipe and, the food available. Or it could be just really quick options, like I'm going to just throw a steak and vegetables together, or, barbecue chicken and some veggies together, or, whatever it might be. Or if you're coming up to a week and you're like, oh, actually my work week doesn't look too bad this week, maybe I can put a little bit more extra effort in. Maybe I can do some meal prep on the weekends. Maybe I can, try a couple of new recipes. Maybe that's that time where you work just that little bit harder to make sure that your shelves are stocked and your fridge is stocked and there are some meals on hand for the weeks when you do get busy. So that thinking forward is absolutely key. And you can do that obviously with exercise. You can, do it for other areas of lifestyle as well. Yeah.
Fantastic. No, that's great. So what are your top tips to help people practice healthy living habits while in lockdown or out of their, let's call it their routine, in order to be able to adapt and overcome any obstacles that they happen to be presented with?
I think one is self-care is one of my top tips, because it can be a stressful environment. A lot of us have children at home at the moment, whether we're homeschooling or we've got preschool kids at home, and life has just become a little bit more hectic for a few of us. So I think self-care is probably one of my number one tips. What can you do maybe to get out of the house or to get some sunshine, to get some physical activity, or maybe it's a meditation. So what can you still do now for your mental health as well as your physical health?
Yeah.
So that's probably my number one top tip. And whether that means a little bit of negotiation with your partner or other family members, to mind the children or whatnot, while, I go out and go for my walk, or whether it's that organisation and planning and going, all right, first thing in the morning, I'm going to put, 20 minutes aside to meditate, or at the end of the day, or what, whatever that looks like for you. But that's definitely my number one top tip, because you need to put your oxygen mask on first, don't you, in order to show up and help other people and be a good, worker, partner, parent, etc.
Yeah.
Second tip would be, let me see. I'm thinking, which area should I go into? So nutrition, you're probably interested in. So second tip for nutrition, I think really in terms of probably not having food too close to you.
Yeah.
Because we're all working from home at the moment. So sometimes I've noticed my clients feel like they're grazing a little bit too much, or they've got the food on the desk, or they're going back and forth to the kitchen. So yeah, not having the food too much in physical proximity, or understanding yourself first and what you put in your physical environment. And if you know that you're a person that if the chips in the pantry or the chocolates in the pantry or whatnot, maybe either negotiating if a partner wants that, and going, oh, maybe a type of chip or chocolate that you don't like, or not having it there, or working out what you can portion control and not feel tempted to graze on all the time. So really sort of thinking about your physical environment and how you set it up for success, whether it's food or whether it's exercise. So for some people, from an exercise perspective, it's leaving resistance bands and weights around, or having their exercise shoes ready to go, so joggers ready to go first thing in the morning. So how do you set your environment up for success, knowing that we're in a different situation at the moment? That'd be my second tip.
Brilliant.
How many do you want?
Yeah, I guess, getting good amounts of sleep, which is something you're always reminding me of.
Definitely, yes, and that's you're not the only one, Jerome. So
I'm sure not.
When lockdown happens, a lot of my clients are like, oh, I'm just getting to bed so much later than I was before because I don't have to commute into the city. But they're like, it's kind of had this flow-on effect where I'm not getting up to do my exercise in the morning, or I'm feeling more tired, and I'm suddenly grazing on the couch while I'm watching, something on TV, or Netflix or whatever. So yeah, definitely. I think when you talked about sort of patterning and being in a routine, sleep is definitely something that you have to be more in a routine with, for sure. And even though we're at home, recognizing that, okay, well, if you are staying up that little bit later, what are you giving up, or what are you sacrificing? So what's the flow-on effect? And we know that when people aren't getting enough sleep, there's problems from, lowered metabolism, high risk of chronic disease. But we also know the behaviours, when people don't get enough sleep, they're more likely to feel more hungry and less satisfied, to do with the hormone regulation. And because they're tired, they're just more likely to, want to grab things that aren't so good too, less likely to exercise. So it is that sleep has a real flow-on effect, or not cope well too with stress and other things that are going on. So yeah. That'd be my other tip.
Yeah. I mean, we could, as you said, we could talk for hours on these topics and still only scratch the surface. But it's been absolutely fantastic and a privilege getting your insights. You've made it so enjoyable to listen to. Thank you. So, if people listening and watching want to get hold of you to possibly work with you, what's the best way for them to do that?
Sure. So my website is www.discoveryhealthcoaching.com, or they can email me.
We'll put a link below the
video. Yeah. So email me. Put my email down, which is just Shivaun@discoveryhealthcoaching.com, or contact us form. My mobile number's on there as well. You can give me a call.
Awesome.
Or book in for a free discovery call. I do 15-minute free discovery calls as well for people to just have a chat with me and see if we're a match. Yeah.
That's wonderful. No, thank you so much, Shivaun. Thanks for your time and your expertise. It's always wonderful talking to you. And yeah, look forward to chatting to you again soon.
My pleasure. Thanks for having me.
Thanks so much. Cheers. Bye.